Hello, this is Kelly McGraw. I'm the Director of Access at Helios Care. Many of you are tuning in because you understand why advanced care planning is important. Congratulations. That's an important first step in the process. To assist you in getting started with the rest of the process, palliative care and hospice professionals from Bassett Medical Center and Helios Care are here to talk to you about some of the nuts and bolts of advanced care planning and to provide you with some helpful information. Let's face it, there are many people who, like you, agree that it's important to have thought about completing an advanced directive, but maybe haven't quite gotten around to it. Others may not even have had a conversation with anybody about the kind of care they would want or not want at end of life. We see that all too often, and we see the hardships and angst family members or loved ones face when trying to make a decision on behalf of a patient who's already in crisis. They're felt that they're left guessing or are filled with doubt and or guilt. As a matter of fact, there's an interesting study from a group called the Conversation Project, who surveyed over 1,000 people over the age of 18. And here's what they found. That 92% of them agreed that talking to their loved ones about end-of-life care is important in their end-of-life wishes. Yet only 32% have actually done so. 80% indicated that if they were seriously ill, they would want to talk to their doctor about the kind of medical treatment they would want. Yet 18% reported having had this conversation with their doctor. So what we say isn't always what we do. Why is that? What's holding us back? For some, it might be a question of when. Some may say, well, when I have time. Or now's not the right time. Now more than ever, it's a crucial time for all of us to be thinking about and talking about our end-of-life wishes. This is mostly what advanced care planning is all about. Others may feel that it's too soon. We know from our experience that it always feels too soon until it's too late. Others may want to have a conversation, but they don't know how to bring it up. We realize that sometimes the most important conversations are the most difficult. It's uncomfortable, or we don't want to make someone feel anxious or angry if we bring it up. So my colleagues are here today to help you with these conversation starters and to give you some questions or decisions you and your loved ones may want to consider. Some may be putting it off because they just don't know what it all entails. We do realize that some of us in the field easily throw around a lot of terms and it can get confusing, like advanced care planning versus an advanced directive. Many still don't know what a living will is. I thought I already had a will. I took care of my estate. What's the difference between a healthcare proxy versus a power of attorney? We know that in healthcare, we love to use acronyms that don't really mean much to the rest of us, like POLST or MOLST or DNR, DNI. We're here to simplify some of that for you so that you can have a more confident and better understanding of how basic advanced care planning really can be. Speaking of some terminology, which sounds like a lot of legalese, many have the misconception that they have to wait to get an attorney involved. It's okay if you do, but it's not necessary. Or they're not sure who needs to be involved. Does this mean I need to make another appointment with my doctor? So it can feel overwhelming and thereby encourage us to procrastinate. Finally, some may just not know where to start. And we're here to help you with that too. So with that, let's get started.
Thank you, Kelly. Hi, this is Dr. Shelby Cooper. I'm a physician at the Bassett Medical Center. We are going to be discussing advanced directives today. We have a panel today. We're going to be discussing the how-to aspect of this. really a nuts and bolts type discussion. Previously, we did do a webcast on the why aspect of this. Why should you consider this? And had community members and physicians and others on that. Please refer to that if you'd like. Today, I'd like to introduce our panel. Dr. Chris Mullock from Helios, Dr. Laura Cunnington from the Bassett Medical Center palliative care team, and Soraya Mostart, also from Helios. I'd like to thank Kelly for that fantastic introduction. Laura, why don't we start with you? When should you do this? When is, and I know a number of these things were brought up by Kelly, and I'm gonna go through some of these things, and we can talk about them. But when's the best time to approach advanced directives?
Sure. So I think that a lot of people are concerned that it's too soon, or they're not, they don't have all the information that they need at any one point. I think the most important thing is that you start thinking about it and you have the conversation sooner rather than later. These conversations can be really helpful to families and loved ones, because you just never know what's going to happen. Any of us could have an accident at any time, and all of a sudden our loved ones are in a position of needing to make medical decisions for us. So thinking ahead of time about who you would want to make those medical decisions and having a conversation with them about what kinds of things that you want and what things you absolutely don't want is appropriate at any point.
Should every adult be looking into having a living will, even if you're healthy and you're 30 years old? Is this something that everyone should do, or really should you wait till you're 70 years old to do this?
No, every adult should have a living will, should have thought about it, should know who they would want to make decisions, and should start the process of this. It can be changed over time, and anytime you have a change in your medical condition, you probably should think about updating and rediscussing with your loved ones what your wishes are.
Soraya, how do you do this? What are the first steps to making this work?
I would say the first thing you need to do is talk to your family and identify who you would want to make healthcare decisions in your behalf if you are not able to speak for yourself. And to remember, this doesn't go into effect unless you can't make decisions on your own. So the first thing you would do would talk to them, make sure that they agree to be your healthcare agent. And then you would want to contact your provider's office directly. You can go to My Bassett Health Connection and message your doctor, or you can just call up your local provider. You can also call Helios Care, and we offer to help people connect and get these forms taken care of. You can even just call and just say you want to set up a visit to have your discuss advanced directives.
So even if you're not involved with hospice care through Helios, it's okay to call and you'll provide some help?
Absolutely. We really want to encourage people to get this done and to really have these conversations now. Okay,
great. Dr. Mullock, or is Chris okay for the rest of the talk?
That's perfectly fine.
Okay. Well, Chris, what mistakes do you see? I'm sure you've seen plenty of mistakes. Obviously, not doing it is the primary mistake, but what else?
Yeah, there's obviously a lot of mistakes. As you noted, not doing it is probably the biggest mistake. If you don't do it, there's less chance of having your wishes respected. You have an increased chance of having aggressive care, which some people would not want. You have an increased chance of dying in the hospital. And I would note that sometimes dying in the hospital, not always, but there's been some data out there suggesting that deaths in the ICU may not be as satisfactory as dying at home. Of course, again, that's a patient preference. But other pitfalls would be this. As some of the other people on our panel have noted, have you really talked to your family? That'd be the first thing. Have you chosen a healthcare proxy? And if you have, is that the right person? For instance, you want to choose someone that's going to respect your wishes. I can't emphasize that enough. Choose someone that really understands you and what you want. Another potential pitfall along those lines is, did you tell the person? It's not uncommon to choose a healthcare proxy, and that person may not realize it. And it could come as a shock to them if you're actually acutely ill or sick and you need help at the time. A final pitfall, I would say, is to make sure that you adjust or amend your wishes, which can change in time. So that would be a final pitfall, I would say.
Right. The other panelists, any further thoughts on mistakes or pitfalls you've seen?
I have a couple thoughts on that. Sometimes people will tell me that they worry that if they appoint a healthcare agent, then that person would have authority to put them in a nursing home. And they say, oh, I can't do that yet. Mm-hmm. But really, this will only go into effect when you can't speak on your behalf and when you're incapable of making decisions. So it's on the back burner, but it's good to have, because that situation could come at any point depending on what happens in our life. And also, I think that people assume that the healthcare agent would need to be somebody that they live with, but that's not necessarily maybe the best person. So you need someone that can speak on your behalf, that can advocate for your wishes, and that can really communicate with providers. I've had people that would say, well, I would have my spouse, but I don't know what to do because my spouse has the beginnings of dementia, and I think this would overwhelm them if we were caught in a situation where I was in the hospital. So you would want to then maybe possibly appoint someone else, because that person would really be able to advocate for you and communicate well with providers.
Great. Now, I'll throw this out to the group. Who takes part in these discussions, or is there not really a standard formula? Primary care providers, lawyers, clergy, other family. What's the best way to go about this?
I'll say first, you have to understand what your wishes are. I think that's important, and to think about that. And as Dr. Cunnington had noted, and I think Soraya had noted, talk with your family. So I think that's the first thing. A lawyer is really not necessary. These are meant to be easy. So a lawyer is not really necessary. There are power of attorneys where we're talking about bigger estate plannings. A lawyer might be considered there, but that's not really applicable to healthcare decisions. So once you know what your wishes are, your family understands your wishes are, you can actually fill out a couple different forms. For instance, Helios Care has a 5 wishes form, which is really a combination form and a healthcare proxy form. And all you really need are witnesses to have that done. So the forms are actually very easy. You should talk to your doctor at some point, and your doctor really does want to talk to you too. So I think it's important to include your healthcare provider. So at a certain time, maybe an annual exam, that's a good time to do it. If you're in the hospital, the person caring for you in the hospital will probably want to talk to you about that. But these are designed to be easy. The process is meant to be easy. And I'll let the other panelists take it from there.
Sure. You brought up a couple of points that I thought were worth mentioning. The first is when talking about having a lawyer involved, there's no problem with that, but I think it's important to delineate the difference between a healthcare proxy and a power of attorney, because we see people show up at the hospital a lot with a legal power of attorney form, which gives you all kinds of abilities to take care of finances and legal matters, but that's not the form for making healthcare decisions. So it can be very disconcerting when the time comes and we're telling people, no, you needed a different form. So along with your power of attorney. If you do that with a lawyer, make sure you do your healthcare proxy as well, because it doesn't cover both necessarily.
That's a great point. And Kelly did allude to this. There is a lot of terminology that can be confusing. Hopefully the PowerPoint that we provided can be helpful in that way. But living will versus healthcare proxy. Somebody want to describe that versus the New York MOLST form? What's the differences in these forms? Laura?
Sure. So all of the different forms, advanced directive forms, there are many different types, and really this is a form, the 5 wishes form, which should be included in this presentation, probably with a PowerPoint, is a great starting off point for recording what your wishes are. This is a form that will help to guide a conversation with your family and friends, whoever your loved ones are that you want to help with making these decisions if you're not able to. There is a healthcare proxy form for the state of New York. This form is just the one who says, this is the person that I want to make my medical decisions if I'm unable to. The New York MOLST form is a much more involved form with more specific questions, and that's one that probably should be done in a healthcare setting with your primary care physician, and should be signed by them. Any of these forms are good to have. Any of them are helpful. One other thing under mistakes that people make is filling out a form and then not giving it to anybody. So if you show up in the hospital, say you had a car accident, you can't tell us what your wishes are. You may have a MOLST form, a healthcare proxy form. We have no access to that unless you've given it to your loved ones, your primary care provider. Get it out there and make sure people know it exists.
Yeah, I'd like to again echo the 5 wishes form, because really that is a living will. Living will just says, what are your preferences? What do you want? But also has the healthcare proxy component, and that just says, who do you want to make decisions when you can't? So it's a good combination form.
Where do you find the 5 wishes form?
It should be available at Bassett. It's definitely available through us at Helios Care. Sarah, I don't know if you could state more to that.
Yeah, and this form is very easy to fill out. I also want to add that it's so simple. It only needs to be witnessed by 2 people. It doesn't have to even be a medical person that witnesses the signature of this form. The only thing is it can't be anyone. No, the witnesses can't be named as the agent when the person signs the form. But absent having a healthcare proxy form signed, then if you don't have that, then it would default to the Family Healthcare Decisions Act. So I had a patient once that had physically separated from his wife 20 years ago, but he wasn't legally separated. So without an agent named, then legally it would default to his spouse. So, and he did not want that. So it was very important to get this form in writing so that the person he wanted to speak on his behalf could do that. And he didn't have to get divorced. He didn't have to deal with any of that other legal stuff. He just needed to have this healthcare proxy form signed.
Right. And are these forms all available at home online? I mean, can you just simply upload these from the internet and print them up and fill them out at home? Is that acceptable, or does it need to be a more involved process than that? Soraya?
Oh yeah, sure. So you can find them in different places, but we will mail them to you too. If you want us to mail you a form or a copy of this, Bassett has them, like Dr. Mulick said. They're really readily accessible, and the 5 Wishes Foundation offers them free as well. You can just download a copy from the internet.
Right. Okay.
I'll note too. My wife and I lost our 5 Wishes form about a year ago, and we didn't realize it. So within the last couple of months, my wife and I just redid our 5 Wishes program, And between the two of us, it took about 15 minutes.
Okay, well, that's great.
And if you've done one and you can't find it, the newest document will supersede anything that was previously written. So if the person that you had named before passes away and dies, then you'd want to create a new one. And you don't have to worry about, I have to, shred that one necessarily. You need to just make sure that your providers have the most current one available.
So is this something, if you fill this out at home, is this something you should then forward to your primary care provider's office? Is that the appropriate thing to do?
Yes, definitely.
Right. Okay. All right. Well, great. So the first step for anybody that wants to get started with this sounds like the 5-step form. Do I have it right? It's the 5-step form?
Five wishes.
5 wishes form is the first step for most people, and then confer with your primary care provider, and that's probably the first person to discuss this with, I'm assuming. Yeah. Okay.
Mm-hmm.
Yeah,
right.
I'm of the mindset that if you're going to talk to a provider, a physician, I know Dr. Cunnington has these conversations. I have these conversations, but one of the best people to do it would be your prime care doctor, because they know you over time. They know you longitudinally. We often just meet people for the first time. So we're happy to do it, but if a primary care provider can, that's wonderful.
And part of the reason for that is in some of these decisions, whether you would want to be have a DNR, or whether you'd want, I had a patient who had Parkinson's, and she was worried that, her family didn't know if she would want a feeding tube or not want a feeding tube when she would have trouble swallowing. And so your primary physician would be the one to talk to, because they tell you the likelihood of how you would respond to that, because they would know you. So it would be important to have that conversation with them so that they could give you that guidance on how your body would be affected by those treatments, which can inform whether you choose to want that or not as part of your wish.
Well, great. I think we're going to wrap it up. Any further thoughts or recommendations from any of the panelists before we close?
Sure. I would just suggest that doing these forms, it may seem difficult at the time, but it's really a gift to your loved ones to have your wishes put out, because then if and when the time comes, they will not have to try to figure it out for themselves. It'll already be sorted. And so they will have a guide to go from, which makes them feel a lot better at an already really stressful time.
And I would like to say, too, that talking with your family can seem like a hard topic to bring up. However, it's on people's minds the possibility of needing to go to the hospital right now. So it's already in the back of everyone's mind. So it's a good time to start the tone and set the example. Everyone, because we're home right now, we're thinking of things that we have been putting off and we need to do. So people are spring cleaning, or people are, doing projects around the house. This is something we don't want to put off anymore. And so to just start that conversation with our family, it sets a good example. You could say, I've been thinking about my own decisions and what I would want. Maybe we should all talk about that and just see what everyone's feeling about this, and just start that conversation, and it'll get the ball rolling.
And I would add that as healthcare providers, our goal is really to respect your wishes. We want to find out what your goals are. We want to find out what your wishes are. We're not necessarily here to influence you. There's no right or wrong answers here. So we want to address your concerns and address your goals. So we're happy to have these conversations, and we're happy to talk about advanced care planning.
And I have one more thought to add. In naming a healthcare proxy, I will often work with families that have, the mom has 5 children, right? So she's like, I just don't know who I would pick. And really to try to, as your family is talking this over, to know that this is not you don't have to take it personally who's in that role. We all have different roles in our family. So this is really just somebody that can be the spokesperson for the patient on behalf of the whole family. So it doesn't have to cause divisions or make any difficulty within a family. It can really connect a family, because they will feel more united, knowing what the person wants and then knowing how to convey that.
And I should note too that if there is a time crunch, if you're a provider and there is a time crunch, you could always call Helios Care. We'll come to your home. It can be a calm setting. We're happy to talk over things with you. Again, there's no right or wrongs, and we can address these issues in your home.
That's great. Well, I appreciate that. A lot of different thoughts and perspectives. Hopefully, for the audience, this was helpful. Thanks for joining me today.